reading. At the same time, we will have discussions on other subtests as well in the second segment. First segment, some material sent by somebody. I don't remember the name. Maybe you can identify. Somebody has sent me a material on reading part A, saying that's very challenging, and also reading part B. So those new materials will be handled today. And we'll be rocking on some new strategies and tips for reading part A. And there is nothing called time management. Somebody was telling me it is very difficult for me to complete within the time. Time management is challenging. There is nothing called time management in OET. Once you are competent, the time will subdue. You'll have more time. Okay, so let's go into reading. Let me share my screen. Just let me know if you can see it. At YouTube comment space, just respond if it's visible. Cool. Is it visible at YouTube? Visible. Okay. So reading, this is not reading part C. Today, reading key skills, reading part A, we will be dealing with first. Then we'll get into B. Then we'll look, if need be, we'll get into C. So reading part A, questions 1 to 20. We'll be looking into 7 steps. If you have watched my previous videos, you have seen 12 steps. Then the second stage, you have 7 steps. Then at the end, you need, maybe next stage, you need only 4 steps. And once you're competent, you have only 1 step. Okay. So reading part A, step 1, main heading, visualization. If some of you have watched my videos, you might have seen something called FIRST method. F stands for foreseeing, I stands for investigation, R stands for reading, and S stands for speaking out, and T stands for teleprinting. Now we will be just foreseeing here, main heading, visualization. Today's main heading is osteoarthritis. Okay, so second step, we'll just have a glance at the steps. Reading step 2, write down the headings for 4 texts. Hope you have a pen and notebook. Write down these steps, okay? You have to practice step by step. Then only you'll be able to manage your time and gain competency. If you systematically practice as I guide you, you will achieve very soon. Otherwise, it will take longer time, maybe 4 times more. So first, you visualize. We'll be doing it. I'll explain those things, how to visualize, what to do at each steps. I'm sorry. After writing each step, you can leave some space, okay, so that you can fill in there. Otherwise, you have to repeat the step again while I'm explaining. Otherwise, you can leave some space. So step 2, write down the headings for 4 texts. That is text A, text B, text C, text D. As you know, reading part A will have 4 separate tests, but then 1 theme. Step 3, skim 4 texts and highlight the keywords. 20 seconds each for each text. 20 seconds for text A, 20 seconds for text B, 20 seconds for text C, 20 seconds for text D. And I already taught you how to skim and what are things you have to look for. Okay, we'll not be explaining that here. Okay. Step 4, read question statement. Sorry, there is a mistake. Here it should be 1 to 20. Okay, question 1 to 20. Read question statement. Questions 1 to 20 and highlight the keywords and match each question with the text. Okay, highlight the keywords based on the 4 headings. I'll tell you how it is to be done. Step 5, locate the answers in the text for questions 8 to 20. 6th step, write down the answers in the space given in the answer booklet. 7th step, proofreading or spell check is very, very important. Much more important than attempting the questions. Okay. And let's see how the steps go on. We'll practice with one thing for main heading. First Step 1, main heading, visualization. Step 2, write down the headings for 4 texts, 4 headings. Then step 3, skim 4 texts and highlight the keywords. Each text may be around 20 seconds. Step 4, read question statement, questions 1 to 20, and highlight the keywords. Question 5, locate the answers in the text, that is answers for questions 8 to 20, and write down the answers in the space given. Question 7, step 7, proofreading or spell check. Okay. Reading part A, questions 1 to 20. We'll be practicing one topic with this. Okay. Okay, main heading. Sorry. So what is the first step? The first step, main heading. Now what is the main heading here? Just type in. Do you understand what is the main heading?
Osteoarthritis.
Osteoarthritis.
EduSkills respects the copyrights, but I don't know what the copyright it is. Somebody has sent me this material, some learners asking me to explain this. Okay. So we respect the copyright of the materials. Okay, main heading, visualization. So osteoarthritis, when you say that, what do you remember? What you can think of?
Pain.
Pain in the knee.
Swelling. You can type in at YouTube comment space. Yeah, others can type in. Those who are at YouTube can comment in at the YouTube comment space. Yeah. What else? Osteoarthritis. Inflammation. Then anything else? Swelling. Okay. Pain. Right. Knee. Yes. Yeah. Okay. Knee pain, swelling, inflammation, pain. Okay. Inflammation, I just observing what they are typing in the YouTube comment space. I'm coming back to Zoom. Okay. Mobility issue. Great. Mobility issue. Yes. The more you are able to foresee what is going to happen in this text, like mobility is an important thing. So you will understand better and you will get the answers easier. So pain, swelling, inflammation, pain is mobility. Okay, let's see. So first step is visualizing, just visualizing what will be the content of these texts. Step 2, write down the headings for 4 texts. You know, there are 4 texts, text A, text B, text D. So here there is no heading. So what you will have to do, text A, there is no separate heading. You will have to just look for subheadings. Before that, osteoarthritis, the most common joint disorder, often becomes so. You can either write as description and classification or definition and classification as the heading. Then text 2, diagnosis of the key osteoarthritis, physical examination, imaging text. So maybe if it's enough, you can just write diagnosis, in which you will understand physical examination, imaging tests are cool. But then in the initial stages, you can write any amount of words over there. Okay, may not be just one word. It's for your convenience. So write down those things. Text C. Text C speaks about the healthy knee and
It's your anatomy.
Yeah, anatomy or healthy knee, and here they have said healthy knee. Here, for example, you see normal joint space here, joint space narrowing here. So this is diseased knee. This is healthy knee.
Pathology, yeah, anatomy and pathology, yeah.
Yeah, so there is a comparison. So you see, knee osteoarthritis causes cartilage to be lost. If you don't understand, read the topic sentence, first sentence. So what does it says? Oh, please, who is that? Nitya? Just send them, okay. Others, yeah. Please, when you are not if you have background distractions, please don't interact. Okay, I'm repeating that always so that we don't disturb everybody. So what does it say? Knee or osteoarthritis causes cartilage to be lost. What is the meaning? It's speaking about the effects, right? effects or implications. The ligaments become lax and the joint becomes less stable. What do you say in medical language?
Complications.
Complications, exactly, complications. So I have put it here implications, but that should be complications, right? That's the right answer, right word. Okay, but then for time being, implications means complications. Okay, right? What does it imply? Okay, so fourth one, treating osteoarthritis of the knee. So head will be treating.
Treatment.
Yeah, treatment. Yeah, yes. So first heading, you can write anything as you want. Definition, age, causes, classification, all those things are diagnostic, science, investigation, structure, law, even subheadings you can write if you want, write down for your understanding in the initial stages. But then I made it as small here, short, definition and classification, diagnosis, complications, and treatment. Okay. Write down these 4 headings in short, whatever way you want. Write it down on each page, top of each page. The booklet, the question booklet as well as the text booklet. Okay. So write down the headings for 4 texts. Text A, text B, text D, C, text D. A, definition and classification. B, diagnosis. C, implications. D, treatment. Maybe in the initial stages, you can write even more things. As we skim through, we will understand. Now, step 3, skim the 4 texts and highlight the keywords. Text A, text B, text C, text D. You can take more time, but then 20 seconds will be enough. Later on, now you can take more time, no issue. So you have to skim the text. Okay, now how do you skim? Yeah, what are the important things in definition and classification? Yeah, let's see.
The topic sentence.
Osteoarthritis.
Osteoarthritis.
Osteoarthritis. Numbers
Okay,
4.
The numbers 40, 50, 50, 40.
Yes.
Yeah, as I told you, numbers are one of the things that you have to highlight. One of them or more than one will be the answer for the questions. So when you skim through by using 20 seconds, just highlight, just circle the numbers given.
Word most.
Conjunction, and
Sorry, my
again
system is
the
slow.
age.
Yeah. Anything
Conjunction.
else?
Men and women.
Most occur in men.
And men and women.
Men and women. Yes, okay. Men, women.
Between the brackets, idiopathic.
Yeah. Then what else?
Classification,
Classification. Primary,
Idiopathic.
or secondary. Whenever there is a conjunction like or and, those things will be important, right?
Yeah.
That is common for all A, B, C, all the parts. Okay. Yes.
Examples.
Examples. Yeah. Example. Then
Chondromalacia.
mild
Younger
and
individuals.
mild form. Okay.
Mild form.
Usually-
Younger individuals.
Younger individual.
Such as hand, feet.
Such as
Chondromalacia.
organs, body parts. Yes.
Chondromalacia is a disease condition.
Okay.
Chondromalacia.
Where is it? Control the results from.
Classification.
Form.
The results
Mind
from.
form.
Cause and effect language is always important. Cause
Result.
results from. There is some. That get moment.
Result.
All these conditions, right?
Hemochromatosis and
Disorders.
recent disease.
Disorders.
Metabolic disorders.
Then infections. Yes.
Such as rheumatoid
Let's see.
arthritis, gout.
Yeah, arthritis.
Last one.
Last. Okay, function of rheumatoid arthritis, gout, and okay, that's cool. You need to get everything, but just to get an idea, what are the things here? Okay. So, what do you think? What are the things here? If you write some more subheadings, here there is description. Then age is there, right? Age numbers are age.
And the incidence more in women than men. No.
See, osteoarthritis, which age group gets it? Which age group is affected by this? Which gender, men or women? Then classification, what are the types? Then
Primary and secondary.
what are the other complications? Right? Results from means this is the result of, or the osteoarthritis is the cause, and these are the results, effects.
Causes.
Okay, cool. That is enough. Let's see.
Okay.
We'll be coming back again. Let's go to the next. Okay. Okay, text B. Now, diagnosis is the heading I have given. You can give any heading, that's for your own convenience.
Physical
Yeah,
examination.
physical examination.
Image test. Image test.
Image.
Between
Okay.
the brackets, assisted and
Image
self-direct.
test.
Yeah, okay, swelling and other things. So many things you can just have a glance, okay?
Okay.
Yeah.
And joint swelling.
Self-directed.
If there is some particular part of the body parts, you highlight, okay? Then this say joint swelling, warmth, all these are bullet points, right? Inability to instability of the joint, range of passive self motion. See, some names are there. Okay, brackets, and when there is some meaning, even in mark bracket, that could be important. Then pain and weight is placed in the knee, again knee. Body parts are always important.
Then imaging test.
Any signs of injury, muscle tendons. You can just glance through because these are bullet points, right?
Yeah.
Yeah.
Imaging
Again,
test.
Then imaging test,
Again.
X-ray,
Imaging test.
MRI, CT,
Yeah, X-rays, imaging tests. Yeah.
MRI,
And CMRI.
Right.
Yeah.
CT,
CT.
Yeah,
magnetic
MRI,
resonance.
CT. Yeah, MRI.
CT.
Yeah. CT scan.
Bone and soft tissue.
Bone scan.
Bone soft tissue.
Bone scan.
Yeah.
Bone scan.
Bone and soft tissue.
I didn't get you. Where is it? Bone and
Last
soft.
line.
scan.
Bone and
the
soft
tissue of
tissue.
the knee.
And the
bone scan.
Yeah.
Or a
Yeah.
bone
That
scan.
will be cool. That will be cool. Let's see. Okay. We'll come
Okay.
back. Just to tell you, this is the step. Where is it? Text to be C. Yeah, this is C. Always if you there is no heading. Now we have given some heading like complications, right?
Yes.
Now,
Mhm.
if you don't understand, just read the topic sentence is always important. Read that, you will understand. So, causes cartilage will be lost. The ligaments become lax and joint.
Ligaments and tendons.
Okay, ligaments. Okay, ligaments, tendons. Yeah.
Ligaments and tendons.
Tendons.
That's why.
Yeah.
Bone spurs are a common
Scan
feature.
of
You're allowed to. This is a comparison, right? This is healthy. This is so. Whenever there is comparison, whenever there is comparison, it must be from here. So all these are like you'll have to just glance through in the healthy and in the when you see some problems caused by osteoarthritis, answers will be here. Osteoarthritis often results.
Often.
There is a cause and effect language. Okay, that could be there could be the answer. So you have in bone rubbing bone. Okay, bone rubbing on bone.
Bones.
Okay, my system is a bit slow, not as energetic as your bones first, right? Okay. And here I can't highlight this is a screenshot I have added here. So you know the idea. Okay, healthy and unhealthy. So coming to text D. This was treatment, right? Treatment.
Arthritis of the knee.
Treatment. Okay. Treatment was the heading. Then you have to have all the side headings are important. All those
Injection.
all the subheadings are important always. Yeah. Then anything. This is pain relievers, anti-inflammatory drugs. And when there is anti-pain reliever or painkiller, something, this is from here, right? When you glance through this, all those names of painkillers will be from here.
10 days.
Pardon? Yeah.
More than 10 days.
10 days. More than 10 days.
Yeah. Where is it? Yeah,
The
10
way-
days. Okay, about that 10
pain
days.
relievers that were.
Yeah, that is about connected with the pain relievers. Okay. Anti-inflammatory drugs or pain relievers. Then the injections or
Okay.
cortisol, steroids, all those things.
Using
By
devices.
having a look at this, using devices such as brace. So brace, like braces.
Types of brace.
Then physical and occupational therapy.
Surgery.
Okay. Then surgery. Okay. Surgery.
Yes.
And recovery time and rehabilitation depends on the time of surgery performed. Okay. So let's see how it goes. So treatment. Now what we have to do? We have to read question statement 1 to 20. Okay, there is a mistake. Question 1 to 20. Actually, we have to match between 1 to 7, but then we will be matching the question with the text 1 to 20 at this step. Okay. Now, these are the 7 questions. So everywhere on top, you should have this definition, classification, diagnosis, implications, treatment. Okay. Now, find out anything connected to any of these headings. Question number 1, the different types of osteoarthritis.
A.
A. In
What do you say? You have to say why.
Secondary and primary.
primary.
Different types.
The word is types. Yeah.
Types.
Main word is types.
Types.
Types means classification, right?
Yes, Father.
So immediately we
Yes.
go to A.
A.
So, A is the answer. Here you need not do anything. A is the answer. Second one, a comparison between a healthy knee and a comparison.
C.
Affected.
C.
Affected.
Comparison.
Complication.
Comparison. Comparison and affected. So which is the
C.
text?
C.
Yeah. Yeah. So it is C. Right. Good. Then third one, the causes of osteoarthritis of the knee.
A.
B.
A. Causes A.
Causes A. Okay. A. Because causes cannot be given in diagnosis, complications, or treatment, right? Just that also you can compare. Causes cannot be given in diagnosis, cannot be given in complications, cannot be given in treatment. Then fourth one, evidence of osteoarthritis of the knee. Important word.
Evidence. It means the
Evidence. Yeah. Evidence. Evidence. Where do you find the evidence? How do you find the evidence?
CT, MRI, and
Huh?
Diagnosis.
No. Evidence.
Diagnosis.
Evidence means proof. How do you find the proof?
CT, MRI, and
What are the proofs? For example, you are just having a glance at the patient and doctor is asking, what do you think is the problem?
B.
Yeah, exactly. Yeah. You say, you might listen now. Before the doctor sees, you have seen the patient. Now, doctor asks you, what do you think is the problem? You say, it seems to be osteoarthritis, osteoarthritis of the knee. Then doctor will ask, how did you conclude? Because they have these symptoms. These symptoms, right? There is inflammation, there is pain, all those things. Those are the evidence, right?
yeah.
Yeah. When osteoarthritis of the knee is likely to occur? When?
By the symptoms.
When?
When they're asking
A,
time.
Father.
Time means
A.
age.
A.
Yeah. At 40 to 70, 40 to 80, all those things. When it is likely to occur. Sixth one, how to detect the condition of the bone within the knee?
B, Father. Diagnosis.
I want the keyword.
B again.
B or A.
How?
Detect.
Yeah.
Detect.
What do you do to detect? You do the diagnosis, right?
Yes, Father.
Yeah.
It is B, right?
B.
Diagnosis, yeah. Next, third one, seventh one, medication options to assist with the knee pain.
D.
Treatment.
Yeah, please keep the order, okay? Well, first you say the keyword, then you say B or C.
Medication.
Otherwise, there is no meaning.
Medication.
Okay.
Medication.
D.
That is D, treatment.
D.
See, it is so easy, you know. Maybe one may be confusing for you. It's cool. You require only 490. Don't worry about 10 marks. Okay. Okay. So go on. And some people said they don't believe, like, you know, they find it very difficult to believe so easy it is. Somebody messaged me saying that first I attended your session yesterday and I find it very difficult to believe that it's so easy. Yeah. Otherwise, if you don't go strategically, what are you going to do? You are going to search this in each text, right? Where it is. Yeah.
Yes,
And it's
Father.
going to
Yes,
consume all your brain unnecessarily. So what we are going to do, this is the perfect answer. This answering is all for this 7. That's what we have to do. But then we'll be doing it for 20 questions. Same method, okay? Highlighting the keywords. Now next is, so you can write this way also sometimes while practicing, just to show you. Question, information asked in the 1 to 7 question, different types of osteoarthritis, then text, in which text it is. Then you can write here definition and classification in this space. Okay, here. Got it? That will also help you to develop the skill. Now we will go to questions 8 to 13. Question 8. From what age will you generally start to see osteoarthritis in women?
From what
A.
A for the
Come on, don't listen to me. Don't shout the A, B, C, D. We want how do you, what are the keywords first? Don't shout
Age.
That doesn't make any sense.
Age.
Yeah?
What age?
Yeah,
What age in
yeah,
women?
age is there,
What
women is there. Yeah, both are cool. So first give me that, then tell me what is the text, which is the text. Which one?
A for the
A. Cool. Yeah, that's the way. Otherwise, anybody can shout A, B, C, D, right? Doesn't make sense. Cool. 9. What will best show any alterations to the bone or joint space within the knee?
Alterations
Alterations.
Okay.
in the bone or joint
Bone or
space.
joint space.
This could be
Mm.
C.
What will best show?
B for the
C.
B for the
B?
B.
There is a doubt, right? 7, 9th one.
C.
We'll check.
C.
C.
If you have a doubt, we'll highlight it and we'll check it. No problem. It's only an exercise. Need not be all correct. Yeah. Anyhow, we will be next step. We'll be going to locate these answers. Next one. What is lost from the knees of patients suffering from knee or osteoarthritis? What is lost?
what is lost?
Lost.
Complication.
Lost.
Yeah, complication. What are the complications? What is lost means? What are the complications? C.
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 Complications.
Yeah. 11. What common trait is found in patients with osteoarthritis of the knee? Common trait.
Common trait.
Right.
A. A.
Common trait.
Yeah. Some have some doubt. Let's see. Well, what should you recommend to a patient to increase the joint mobility of their knee?
D. Recommendation.
Joint mobility.
Don't shout A, B, C, D unless you give me the keywords. Okay.
Recommended
Recommend
treatment for the
treatment. D.
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 Yes.
Yes.
Okay. Then for 13, if patient experiences pain in the joints beyond the knee, what might it indicate?
Description.
Experience pain.
Experiencing pain.
Pain.
Might
Experience pain.
indicate.
Okay.
Might
Indicate.
What might it indicate?
B.
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 B? A?
B.
Not sure.
B. B.
Let's see. B and A options are there. Let's see. We'll come back. Okay. Next one is 14 to 20. Question 14. The rate of occurrence of knee osteoarthritis is the same in men and women beyond what age?
What
Men
age?
and women,
Men and women.
The rate of
Age,
occurrence.
The rates of
Rate of
occurrence.
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 Rate
Yeah,
of
this
occurrence.
is more than enough. Age is enough. Otherwise, men and women
Yeah.
is more than enough, right?
Yes,
Yeah.
Father.
A.
Because only what you
A.
need
Yes,
for
Father.
identifying. Yeah. Not to locate the
Father.
answer, just to identify. It is A. Yes. Now, next, question 15. If a patient is suffering with an abrasive feeling within the joint, it is a sign of knee osteoarthritis. Abrasive.
Abrasive
Abrasive
feeling.
feeling. Abrasive feeling.
Abrasive feeling.
Okay.
Sign
Where it
of.
will be?
Could
Sign.
be B.
Knee B.
Sign of
Okay.
knee.
Okay.
Yeah.
Let's see. A patient with sign also you can highlight if you want. Indication. Okay. Indicator. Okay. A patient with question 16. A patient with osteoarthritis of the knee will experience localized pain from the dash.
Localized pain.
Localized pain.
B.
From the
B.
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 Okay. 17. The main aims when managing the main aims when managing knee osteoarthritis are to relieve pain and
Managing
relieve
managing
Relieve pain.
Relieve pain.
one and is there. And is important.
Yeah.
So where it will be?
D, Father.
B.
D.
Hmm?
Treatment.
D.
Treatment.
In the
Treatment
treatment.
D.
Managing.
Okay. 18. Management means treatment and management is given
Yes.
together here.
Yes, Father.
18. You may have to perform an MRI, CT scan, or dash to
MRI.
establish
CT and MRI.
MRI and
Yes.
CT.
D. Diagnosis for the D.
Diagnosis on scan.
This is will be
Yes.
B.
B.
D, Father.
B.
Yes. That's why I say you should have a group practice, so you can simply argue each other, and if somebody will object to you, then you find okay, you can have some doubts, clarify it. 19. Recommending dash for use on a patient's knee may provide structural support.
Structural
structural support.
Recommending
Support. Where it will be?
D.
D. D.
Treatment.
Treatment.
Structural support.
D. Treatment.
D. If regular 20, last one. If regular pain relief or anti-inflammatory medication does not work, what may be suggested?
Anti-inflammatory and pain.
Anti-inflammatory medication.
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 Treatment.
suggest.
D.
D, Father.
Treatment.
So you know where to search for your answer, right? That is
Yes.
so easy. Let's see. So which step is this? Step number?
3.
3.
See, sometimes you can. Yeah,
5.
it looks
4.
like this also. You can put you can
highlight
collect
keywords.
all the questions together and write this way also. Sometimes it's easy to compare all the keywords. No? That's optional. Step 5, locate the answers in the text. Now we have to locate the text. See, we have the highlights. So the first one we actually need not locate, but we are just finding it, the different types of osteoarthritis. We said A, primary and secondary, right? Okay,
Yes.
that is it.
Yes.
Now let's see the next one. See, the causes of osteoarthritis of the knee results from, I said. Causes include, these include trauma, infections. Actually, we had highlighted these things. Results from these causes. Okay, cause and effect language is important to understand. Okay, next one. Yeah, fifth one. When osteoarthritis of the knee is likely to occur. Yeah. When it will occur, they have given at 40s and 50s, by the age of 80s. Then for women, it is 40 and 70. So where the information is, we need not do anything else. Just to, it's not no need to locate, but we are just finding as we are going on. Okay, 8 now. From what age will you generally start to see osteoarthritis in women? Women is here, we have already highlighted, are more commonly affected between the ages of 40 and 70. Yes. And the rate of occurrence of knee osteoarthritis is the same in men and women beyond what age? I don't know. The authenticity of this material, I have a doubt because this type of questions, usually it is not there in the authentic materials, okay? But then still, let's find out because usually we will not be asked to do all the maths here. Direct answers will be here. Now you will have to just find out the answer. The rate of occurrence of knee osteoarthritis is the same in women, men and women beyond what age?
40.
No, beyond. Beyond what age? For both. 40 actually,
8.
yeah. 40, 50 is nearly
Age of
like
80.
they often become symptomatic in the 40s and 50s and in nearly universal by the age of 80.
80.
For men, it is by the age of 80.
Okay.
Okay. For women, it is 40 to 70.
40
So,
and
which is the
70.
common thing? Beyond which age?
70.
Damn
70.
sure to have
80.
70. 70, no?
Again.
Yeah, 70.
Beyond 70. Because here they are starting 40s, 50s.
Yes, yes.
Yeah,
I
here
get
it is still, 40, it is 70. If you say 80, women will not be included, right?
Yeah.
Yes.
But then
Yes,
I
yes.
tell you, damn sure you will not get such calculations in OET, okay? This, I don't know, the authenticity of the, but other questions are okay. This one is not, direct answer is not given. Anyhow, you got it right. If you say 80,
Yes.
that's only for men.
Yes.
If you
yes,
say
yes.
70, men also have at 70. They also have at 80. The rate of occurrence of knee osteoarthritis is the same in men and women beyond what age? Beyond 70. Okay. Yeah. Don't worry about it. It's not going to happen in your exams. So I'll not be doing this for all the questions. See, you have to write down this way: definition and classification. First question. Write down all the questions together. That helps you to understand better, to gain the skill. The different types of osteoarthritis. These are the questions from text A. Third one, the cause of osteoarthritis of the knee. Fifth one, when osteoarthritis of the knee is likely to occur. Eighth one, from what age will you generally start to see osteoarthritis in women? The rate of occurrence of knee osteoarthritis is the same in men and women beyond what age? So you have 1, 2, 3, 4, 5 questions from text A. And out of that 3 questions, you can answer within fraction of seconds, right? First 3, 1 to 7. The first segment.
Yes, Father.
Yes. Now you see all the answers are here. Whatever we have highlighted are the answers. So if you know to skim, it's very easy. Shall we go to text B?
Yes. Shall we?
Let's see. Okay, questions. Just locate the answers. Fourth question, evidence of osteoarthritis of the knee. Evidence, all these are the evidences, right? Pain,
Okay.
swelling, all those. Evidence means all the symptoms. Where it is given only 2. Now answer is to be written, just to write A, B, C, D, right? Fourth question till 7th. Just to locate. Next one. How to detect the condition of the bone within the knee? Again, it is, you have to just say A, B, C, D. This is in
B.
text B. The X-rays of an arthritic knee may show a narrowing of the joint space, changes in the bone, and the formation of bone spurs. Actually, you need not read all those things because from the keywords you will understand. Only if you have a doubt, you can read it. Fifth one, when osteoarthritis of the knee is likely to occur? Sorry, this is not here. Okay, there is a mistake. This is in the first, we already done it. Okay.
Yes, Father.
This
Done.
is not here. This is not here. That was already done. Ninth one. What will best show any alteration to the bone or joint space within the knee? That's question number 9. What will best show any alterations to the bone or joint space within the knee?
Narrowing
Narrowing
joint.
What will best show? How we will see whether there is a alteration on the bone? X-rays.
X-ray.
X-rays, right? X-rays, right? X-rays of an
Yes,
arthritic
sir.
knee may show of narrowing of the joint space. What will best show any alterations to the bone or joint space within the knee? Got it?
Got it.
What will best show? X-rays will show. Yes. Next one. Oh. Yes. Next one, 13. If a patient experiences pain in the joints beyond the knee, what might it indicate?
Rheumatoid arthritis.
Rheumatoid?
Arthritis.
An indication of rheumatoid arthritis.
Okay.
The answer is rheumatoid arthritis. See, what does it indicate? Let me show. See, if a patient experiences pain in the joints, involvement of other joints, beyond the knee, what might it indicate? It indicates rheumatoid arthritis. So the answer is rheumatoid arthritis. Clear? Next one, 15th. If a patient is suffering with an abrasive feeling within the joint, it is a sign of knee osteoarthritis. Dash knee, okay? There is dash. You have a bit difficulty because your language is not that. Grating sensation, abrasive feeling are synonyms. Grating sensation and abrasive feelings are synonyms. So what will be the answer?
Crepitus.
Crepitus. Yeah.
Crepitus.
Yes. Next. Yeah. 18. You may have to perform an MRI, CT scan or dash to.
Bone scan.
Bone scan.
Bone scan.
Yeah. Where is it?
Bone
Yeah.
scan.
Bone
A
scan.
bone
Bone scan. Or a bone scan. A bone scan is the answer. Even if you write bone scan, it will be right. Okay. So I am not going to collect those questions. You can write it for your practice. Only for this one, I will be doing. Third and fourth, C and D, I will not be doing. So these questions are from text B. Evidence of osteoarthritis of the knee. How to detect the condition of the bone within the knee. What will best show any alterations to the bone or joint space within the knee. If a patient experiences pain in the joints beyond the knee, what might it indicate? If a patient is suffering with an abrasive feeling within the joint, it is a sign of knee osteoarthritis. You may have to perform an MRI, CT scan or dash to establish the issue. Yes. So you have all these answers, questions appearing here from text D. Yes. Ready to go to C? Are you exhausted?
No.
No smiles, no smiles, no smiles. Yes. If you don't smile, you will not understand. When you smile, you have more of dopamine cells generated in your brain. Okay. Now we have this one. Yes. A comparison between a healthy knee and a knee that is sick. So, already we have seen nothing to answer there, only to match the text. Next one. What is lost from the knees of patients suffering from knee osteoarthritis?
Cartilage.
Cartilage. Then next one. What common trait is found in patients with osteoarthritis of the knee?
Bone.
Bone spurs. Answer is bone spurs is the answer. They are common. It is already rarely given there. 16.1. A patient with osteoarthritis of the knee will experience localized pain from the dash.
Ligament.
Ligaments.
Ligaments and tendons. Ligaments and
Ligaments and tendons.
tendons. Yeah. And when there is a conjunction, conjunctions are very sweet. Text D. But I'm not going to write the details, show you again and all that. Okay. Text D. Let's see. 7. Medication options to assist with knee pain. All the medications are given here, you know. That is just to match the heading, match the text. Next one. 12. What should you recommend to a patient to increase the joint mobility of their knee?
Stretching exercise.
Yeah, stretching exercises, right? Help keep the knee joint mobile and flexible. Increase joint mobility. Okay, mobile and flexible. Joint mobility.
Mobility.
Yes, and there is a conjunction. We have highlighted. 7. The main aims when managing knee osteoarthritis are to relieve pain and dash.
Pain
Pain
and mobility.
Mobility.
Yeah, don't write return mobility, okay? Only pain and mobility. 19th one. Recommending dash for use on a patient's knee may provide structural support.
Brace.
Yeah, there are like types of braces, arthritis and support braces. And support braces which provide support for the entire knee. So it is braces. Recommending braces for use on a patient's knee may provide structural support. Okay. Last one probably. Last one. 21. If regular pain relief or anti-inflammatory medication does not work, what may be suggested?
Surgery.
When other treatments don't work, surgery may be suggested. And you know from your common sense, right? If no other things work, what you do? Opt for surgery. Yes. So cool. So step 6, we are not going to do now. Write down the answers in the space given, you know, in the answer booklet. Don't write anywhere. Write it in the space given. Okay, in the answer booklet. 7th step, write down the answers in the 6th step. 7th step, proofreading, spell check. Definitely see that osteoarthritis, all those conditions. Even if you make a simple mistake, spelling mistake, you will be penalized. So learn those. For example, osteoarthritis, if you learn the spelling, you can use it for writing letters as well as here, even for listening. So you can use for all these 3 subtests, you can use those spellings. So learn the major spellings. So these are the 7 steps. You can take 1 minute break. If you have any concerns, you can ask me. And ready, if you have energy, we will go for reading part B. These 2 parts were sent by somebody asking to explain. Okay, so I'm explaining this.
Father, I have a question regarding
Please.
diagrams in general.
Okay.
When the diagram there is arrows and y-axis and x-axis.
I didn't get.
How?
Sorry, I didn't get you. Oh, let me check. Let me check who is speaking. 1 sec. Okay. Who is asking? I didn't get you. Sorry.
When there is a diagrams
Okay.
in part A,
Okay.
how can I collect the information from the diagram? That is when there is an arrows and y and x axes, like in sample.
First thing these
in
days
sample
you
2.
don't find normally in the exams you don't find diagrams these days. That doesn't mean you should not have. But if you have diagrams, it's very easy. You find the differentiating factors. Maybe there will be headings given: moderate, extreme, moderate, mild. On top there'll be heading, no, on the diagram. And though there are some unauthentic materials giving all the calculations and all, those things will never come for OET exam. Direct diagrams will be there saying this is moderate, this is mild, this is extreme, something like that. If it is pain. So below, there will be different categories given under below moderate. Below mild, there will be some. Below extreme, some will be there. In the question, they will ask, this is moderate pain is dash. Or this particular, they will give one condition, then it's a dash pain, moderate pain. Direct answer will be direct. No calculations, no other issues or confusions there. We'll work out some of the diagrams, okay? Upcoming sessions. If you have any material, you can send me.
Okay.
So when you send
Thank
me the
you.
material and ask for clarifications, what is an interesting factor is this. I will know whether they're authentic or not. If it is not authentic, I can simply tell you don't practice such materials. It's not authentic. Otherwise, when you ask, I don't know on what you are asking, because such confusing diagrams will never happen. Anyhow, we'll check out, or you can see some of those. I have done all the 5 samples. I think 1 or 2 diagrams are there. In that video, I have clearly explained how to find the answers very easily. And if you have some materials which confuses you, you can send me. Always send me along with answer key. Recently, somebody has sent me one book telling that is it authentic, and there is no answer key. No authentic material will appear without answer key. If there is no answer key, bluntly I can say that's not authentic. Okay? Because how will you judge yourself if there is no key? How can you evaluate yourself? It's meaningless, right? How can a learner understand whether she or he is right or wrong? Yes. That was Deepika, right? I didn't see the person. Okay. Anything else? You can take 2 minutes to grab some snacks if you have. Always keep some snacks, juice, tea, coffee, something, so that you can enjoy the process. Except Minnie Jackson, she came late, so did not take any coffee now.
I was in the YouTube. There was no carrot.
Okay. Yes. We'll be going to part B in 2 minutes. By the meantime, if you have something to discuss, you can. Okay, I'll be listening. Yeah. Anything you want to discuss, keep discussing so that if somebody new gets into the YouTube, they know this session is going on. Hello. Yes. People are getting back, right? Let them come. Yes. Those who are ready, type in ready at YouTube comment space. Let's see. Ready. Yes, one says ready, two ready, Dorothy ready, Subi ready, Vali Prabhakal ready. How about others? You're ready, type in ready, energetic, send some emojis.
Ready.
Pardon? Yes. Come on, fast. Type in, send me some emojis to see that you are energetic, you have energy to go on. And probably when you send me materials, I can understand you haven't attended previous sessions or you haven't seen the previous recordings of the videos, because even this D part you said it's difficult, but it's a common thing as usual. Same strategy is being used. And beginners will have to see the basic videos, okay? Again, we are slowly, gradually putting them into episodes in order. It will be easy for you to access. Yeah. Yes. Thank you for the super chats, Dorothy. Yes. Shall we go? Reading part B. Are you ready?
Yes.
Yes. Beautiful segment. When I see A part, it looks very beautiful, sweet, and tasty. When I go to B, it looks even tastier. Okay. Reading part B, question number 1. No introductions, okay? Maybe you can just, let's highlight. I'm just putting in order. Okay. Oh, sorry. Lost it. Yes. Hope you can see. Zoom the screen, okay? You can see, zoom the screen, yes. Right. Question number 1. What message is being conveyed in this guideline extract? This should be in this, I believe. In this guideline extract. So what is to be highlighted?
Guideline.
Guideline.
Message.
Guideline.
Okay. And message.
Message.
Okay. So what is the message? Option A. Option A. There is insufficient understanding of these systems by most employees.
Insufficient.
Insufficient understanding.
By most employees.
Yes, by most employees. Okay. Most employees. Sorry, highlight it in some other color. Yellow will do. Yes. Most employees. Okay. Option B. Employees are the only people capable of operating these systems.
Absolutely.
Only
People.
Only you say is absolute. If there are beginners, don't believe these people, okay? Only by practice you have to find out, yes. Then, so option C, these systems are less effective if employees aren't included.
less effective.
Aren't
Included.
Are not included.
So, could somebody read this? Yeah. Please, there is background distraction from somebody. Please mute yourself, okay? Now, no more warnings. You'll be sent out, okay? Because it's disturbing everybody. Who will read it? Please.
Extract from guidelines.
Yes.
The core elements of safety and health management systems. Most successful safety and health management system have 6 core elements, all interrelated, each necessary to the success of the overall system. One of those is employees' participation. Employees have unique knowledge of the workplace and must be involved in all aspects of the safety and health management system. For example, setting goals, identifying and reporting hazards, investigating incidents, and tracking the progress. All employees understand their roles and responsibilities under the safety and health management system and what they need to carry them out effectively. Employees are encouraged to communicate openly with the management and report safety and health concerns. Barriers to participants, example, language, lack of information, or disincentives are removed.
Okay. Most successful safety and health management systems have 6 core elements, all interrelated, each necessary to the success of the overall system. Okay. One of those is employee participation. One of the 6. One of the 6 systems, elements, core elements. So where do you have the clue? All employees understand their roles and responsibilities.
Option A is eliminate.
A is eliminated.
Because it is opposite, right?
Yes.
Opposite to what is said in the text. Okay. Then what else is left?
See,
Yes. Yes. Only C is left. Where do you have the clue to C?
Last, employees are encouraged to communicate openly to management.
Okay, still. The topic sentence itself tells you, see, there are most successful safety and health management systems have 6 core elements. One of them is employee participation. If one of the 6 is not included, what happens? It will be less effective. To make it perfectly effective, all these 6 core elements should work together. And again, employees have unique knowledge of all those things. All employees understand their roles. And even this tells you, gives you an idea. Employees are Important. So answer is there. Okay. So barriers to be removed, all those things to make them participate, right?
Yeah.
Clear?
Yes, Father.
If you understand, if you have competency, you have the answer here itself. 6 complements, one of them is this. So there are systems are less, these systems
Yes.
are less effective if employees aren't included. Out of
Yes.
6, if one element is not included, that's going to be less effective.
Less effective.
Okay.
Mm.
Cool.
Yes.
Shall we
Yes,
go to
Father.
question 2?
Yeah.
Yes. Question 2. The directive informs us that employees
Informs.
Inform.
Employees.
Employees.
Option A, don't always have to pay an administration fee.
Absolute.
Always.
Absolute.
Always.
Absolute.
Always is not absolute.
So we don't always.
Hmm.
Don't always.
Not absolute. So no elimination. Objections are raised. Okay, let's see. Option B, split off the cost of the administration fee with their employer.
Split.
Split the cost.
Split of
Split
the
off
cost.
the cost. Split off the cost with their employer. Okay. Option C, who change their packaging arrangements must pay an administrative fee.
Must.
Making arrangements.
Change the
Making
Must be
arrangement must.
arrangement.
Must pay. Okay. An administration fee. Okay. Let's read. Policy directive, procedures for salary packaging, administration fees. Please read.
Each health agency will charge its participating employee an annual fee for administrating their package, which will be deducted on a pro rata basis for each period. The cost of the administration fee, including GST, will be shared equally by the agency and the employee. Health agency may elect to outsource the administrations of the salary packaging scheme. An external salary packaging provider must be selected through a tender process. In all instances, the health agency will require the employee to package salary for the administration fee liability. In other words, the employee recovers 50% of administration fee from the employee. An employee may review the alter their salary packaging arrangement at the end of package year, usually 31st March, at no extra cost. If an employee elect to change their packaging arrangement during the packaging year, they may incur an alternation fee.
So, what is the answer?
Hello.
B.
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 Topic sentence itself is the paraphrasing of this, right?
B.
Topic sentence itself is the paraphrasing of option B. Each health agency will charge each participating employee an annual fee for administrating their package, which will be deducted on a pro rata basis for each period. The directive informs us that employees split off the cost of the administration fee with their employer. There is little competency, authenticity issue with the material language, but it's cool. In all instances, the health agency will require the employee to package salary for the administration fee liability. Again says, split off the cost of the administration fee with their employer.
B. Yes, B.
B, yeah. Don't always have to pay an administration fee is opposite to in all instances, they have to pay. This is the opposite of. They have to pay at all instances, right? But first one says don't always have to pay, only sometimes. But it says in all instances, the administration fee must be paid. This is also particular. Who change their packaging, see, only when, only, this is, see, first one says, don't always have to pay, only sometimes. C also says, sometimes. Who change their packaging arrangements must pay. But here it says, the text says, in all instances, they have to pay. Split of the cost of administration fee with the employer. Is that clear?
Yes, sir.
Like, for example, this is 100%. Option B is 100%. This is 70%. This is 30% or 40%. Did you get it?
Yes,
Now
sir.
the issue is, should they pay the salary packaging administration fees? First option says don't always have to pay, only sometimes. Third option says who change their packaging arrangements pay, means only particular group, only at particular situations they have to pay. Second option says split of the cost of the administration fee with their employer, all the employees should pay. This is all, this is some, this is some.
Should be all.
Do you have any doubt? Hello?
No, Father.
It is clear.
Are you okay?
Yes, Father.
No news? Didn't get it?
Yes, Father.
Hmm? If you don't understand, tell me. I'll give you another example for it. Okay. For example, now you have to pay a toll, right? Toll fee in the roads, national highways.
Yes,
First
Father.
option says you need not pay, always you need not pay the toll fees. Whenever you go, you need not pay the toll fees. Second option says in all instances, whether you go for marriage, whether you go for reception, or whether you go for shopping, whether you go 10 times a day, at every instance you have to pay the toll fee. Third option says only those who are coming from outside the district have to pay toll fee. But the text says no discrimination. Whoever passes through the toll gate must pay the toll fee. Did you understand?
Hmm.
Yes, Father.
Yes, Father.
Yeah, because here it says in all instances, even otherwise topic sentence says each health agency will charge. Will charge means definite factual statement. No excuse. Each toll gate people will charge every traveling vehicle and a toll fee for passing through the or journeying through the national highway. The topic sentence itself says that meaning. Cool? Shall you go on?
Yes, Father.
Okay, even yeah. The question number 3. Question number 3. What is being described in this section of the guidelines?
What is being described?
Describe and guidelines.
Guidelines.
Described and
Guidelines.
Option A, different tactics to use with pregnant women who use drugs or alcohol. Yes?
Different
Tactics.
Different tactics.
Option B, the problems mothers using drugs or alcohol cause their unborn babies. Problems caused, okay.
problems.
Option C, why birth control information should be given to women with the drug or alcohol issues.
Birth control.
Control.
Birth control information.
Please read.
Guidelines for the management substance use during pregnancy, birth, and the postnatal period. Exposure to drugs and alcohol may have a serious effect of the fetus is a very early stage of pregnancy, particularly before the first missed period. Therefore, all women with problematic drug or alcohol use should be provided with advice on contraception. Long-acting forms of contraception are generally preferred, example progesterone implants, IUDs. This approach will facilitate planned rather than unplanned pregnancy and reduce harm to the unborn child.
So which option?
Option
First
C.
option says different tactics to
Option
use
C.
with pregnant women who use drugs or alcohol. Those who use drugs or alcohol, some tactics must be taught to them. How to use drugs nicely, how to use drugs
No.
wisely, how to use drugs and see that others don't get the smell. Is it okay?
No.
No, Father.
Okay. Second one, the problems mothers using drugs or alcohol cause their unborn babies.
No.
Option C.
Yes, it's C.
Option C.
Birth control information.
Do they show the problems of mothers? Do they speak anything about problems of mothers?
No.
No, this can be eliminated from the topic sentence itself because topic sentence is speaking about serious
Serious
effect on the
effect of the
fetus
fetus.
in the very early stages of pregnancy, particularly before the first missed period. So, effect. Effect means problem, right? Cause and effect. Okay, the effect, the problem they face is the effect. Why did birth control information should be given to women with drug or alcohol? Is all women with problem with drug or alcohol use should be provided with advice on contraception. Got it? Yeah. Clear, right?
Yes. Clear.
Yes. I don't know the authenticity of the material. Okay, anyhow, we'll work it out since it is sent to me. Reading question 4. There is one instrument who is cooking with the audio unmuted. Okay. Question 4. Foodborne botulism is known to.
Botulism.
Okay. Option A. Take a long time to develop in most patients.
Long time.
Patient.
Most
Patients
Long
require
time
a
to develop.
specific course of treatment.
Specific
Require
course of
treatment.
Third one, option C, cause death in severe cases.
severe
Death.
Death in.
Okay. Okay, take a long time to develop, then specific course of treatment is required, causes death. Okay, just read.
Yes. Manual extract. Foodborne botulism. Foodborne botulism is due to absorption of a performed toxin from the gastrointestinal tract. The timing of symptoms is depend on the dose of the toxin absorbed. Typically, however, onset is 12 to 26 hours, median 24 hours post-ingestion, but can occur from 6 hours to 8 days after eating contaminating food. Foodborne botulism can be associated with symptoms such as nausea, vomiting, diarrhea, and abdominal cramps, followed by constipation. Diagnosis is by detection of the botulism toxin or by isolation of the organism. A defined equine-derived antitoxin must be given as soon as possible. Do not wait for diagnostic test. Repeat doses may be given within 24 hours if deterioration continues. There is no specific antibiotic for this condition. Supportive care, including ventilation, hydration, and nutrition, will be required during recovery.
B we can eliminate further.
Father muted.
There is no specific antibiotic.
Take a long time to develop in most patients. How much time it does take?
Muted, Father.
6 hours to 8 days.
Our onset
6 hours to
12
8
to
hours,
20,
12
12 to 26 hours. That means 24 hours max. The median means average.
But next.
But can occur from 6 hours to 8 days after eating contaminated food. Can occur 6 hours to 8 days.
8 days.
Does it take a long time to develop in most patients? Typically means what? Normally, generally, majority. Typically,
eliminated A, right?
Option eliminate.
it doesn't take, typically means particularly, generally, or most of the
Typically,
cases, it
normally.
takes 12 to 26 hours. But
Yeah,
sometimes,
normally.
exceptionally, it can take 6 hours to 8 days. Most
Some
patients
people,
take a long
yeah.
time to develop in most patients. Is it true? No, in most patients, typically it takes only 12 to 26 hours immediately, the same day. This is opposite, right?
Yeah.
Yes, Father.
Yeah. Here you are having a problem because of the competence in language. Typically means what you don't understand, right?
Typically, normally, right?
Typically means generally. Normally.
Okay.
What you say normally? Normally is not the correct word to be used there because since you are nurses or health professionals, you used to always say normal, abnormal. But normally, no, it is generally. Generally means most of the cases. Most of the patients. Okay, typically most of the patients have onset in 12 or 26 hours post-initial, but can occur, maybe occur for some people, exception. Got it?
Yes, Father.
Okay. So first is eliminated. Cause death in severe cases. Does it speak anything about cause?
Not mentioned in the diagram.
Yeah, death is never mentioned. Nobody wants death here. Okay, in this paragraph, no death, only life. Okay. Do you have a death anywhere?
No,
Nothing. Nowhere. Then which is the answer?
defined history derived
Is
B
derived antitoxin must be given as soon as possible. Do not wait for diagnostic.
Yeah. Diagnosis is the detection of the toxin or by isolation. Okay. A defined is that? Equine derived antitoxin, all those things.
Derived
Supportive. See, the whole portion says a specific course of treatment. There is no specific antibiotic for this condition, but there is specific course of treatment. Don't misunderstand. There is no specific antibiotic doesn't mean specific course.
Okay.
Yes,
Okay.
Father.
Yeah, I think you have misunderstood there. So someone shouting B could be eliminated. See, there is no specific antibiotic doesn't mean there is no specific course of treatment. Treatment, there is a specific course. What are the specific course? It is given here. A defined antibiotic must be given as soon as possible. Then repeat doses may be given within 24 hours of treatment. Since there is no specific antibiotic, supportive care including ventilation, hydration, and nutrition will be required during recovery. Even ventilation, hydration, and nutrition are treatment, right? Part of treatment.
Yes, Father.
Got it?
Yes, yes.
Yeah. that enhancement of the language happens only by practice. When you practice more and more, you'll get it. Okay. Fifth one. Hope you have stamina.
Yes, Father.
Yes, Father.
The standard explains that in the case of living donors,
Living donors.
Standard explains
Donors.
living donors.
Yes.
Standard explains.
Standard explain.
option A, collection can only take place once their history has been taken.
Only elimination.
Only
Can
collection
only take
can
it.
only take.
Their history has been taken. Only absolute.
Is it absolute?
Eliminate. Yes.
No, it's not absolute. It's not absolute.
You should be sure. Then you say
It's not.
the
Can only.
collection can.
It's not only. It's not only. There is a can only. It's not absolute.
Anyhow, we'll keep it. When you read, you will understand whether it is absolute or wrong. Collection can take only place their history has been taken. B, a therapeutic goods order supersedes all other collection requirements.
All.
All.
What is all?
Absolute.
Yes,
Absolute.
All is
absolute.
absolute.
No doubt, right?
Yes.
Okay.
Interviews
Option C, interviews
outline.
must outline everything that occurred at least 1 month prior to collection.
1 month. prior.
1 month periods.
1 month prior. Okay. Just read. Let's see.
Requirements in relation to the medical and social history of prospective donors. In the case of a living donor, the blood components, cells, or tissues must only be collected from a living donor with whom an interview to obtain the donor's medical and social history has been conducted and recorded in accordance with the following requirements. A. The interview must be conducted with the donor or guardian next of kin by a trained interviewer and should be face-to-face interview. B. The interview must be conducted no more than 30 days prior to 30 days after collection of the blood components, cells, or tissues and must occur prior to any release of the relevant product from guarantee unless otherwise specified in another current therapeutic goods order that applies to the relevant product.
Answer.
C.
A. Answer A.
Answer A.
Prior to
Because C mentioned at least 1 month. Here mention no more than 30 days.
It is.
No more than 30 days.
Yeah, no more than means less than 30 days.
Yeah.
Answer A.
Where do you have answer A?
The first topic
There is.
sentence in case of living donors, the blood and blood component cells or tissue must only be collected from the living donors with whom an interview to obtain the donor's medical and social history. That first sentence.
All agree?
Yes,
This collection can only take place. This is not absolute, right?
Yes.
Collection can only take place once their history has been taken. After the history has been taken, they can collect. So it is not never. It is not never. It's after the case history is taken, you can collect. It doesn't say it can never be collected. So it's not. This is scale. You understand? Okay. So that is clear?
Yes, Father.
Yes,
Sixth
Father.
one. Yeah, sixth question, last one. The purpose of the announcement about the video call platform is to
Purpose
Purpose
of the announcement
purpose.
about the video call.
About the video call.
Okay. Option A, advise users of changes that are taking place.
Users.
Advice changes.
Changes, advice.
Advice.
Okay, option B, outline a range of useful features for users.
Range of
Useful
Users.
Useful features.
features.
Yes. Option C, warn users about potential problems.
One.
Problem.
Potential problems.
Okay. Usually announcement about the video call platform, is it for advising changes or outlining the useful features or warning about the problems? Just read. See whether you can find an advice or an outline or a warning. Okay, the purpose. Purpose means main idea, okay? Not the secondary idea, main idea. The purpose of the announcement means the main idea of the announcement, gist of the, or the purpose of the story. Yeah.
Important announcement. The
Okay.
telehealth platform will be upgrading on Thursday, 13 September. Health Direct Australia will be releasing version 3.9 of the video call platform. This upgrade will not affect the operation of the video call platform, and you will be able to continue to perform telehealth consultations during the upgrade. Some benefits of the new console include mobile friendly, works well on tablets and smartphones as well as desktops, simpler navigation, fewer clicks, improved functionality, quicker page response times after initial sign-in.
Okay. Any idea?
B.
Useful features.
Where will be the
Option
primary or
of
main idea? Where will be the main idea in a paragraph?
Topic sentence.
Yeah, topic sentence. Can it be in the second part, last part?
No.
So can you say outline a range of useful features? The purpose of the announcement.
This upgrade will not affect the operation.
See, we can elaborate further. There is no problem.
Is there a warning?
No,
there is
No, no, it's not warning.
No warning. No warning, because they say you can continue using, no issues, don't worry at all. No warning. Only soothing effect is given. Then now advise users of changes that are taking place, outline a range of useful features for users.
Advise user of change that are taking place.
That is here, right? What is given here? Whenever they ask you purpose or the main idea, it can never be in the second part. It must be in the first part. Topic sentence is the thing. Always, any paragraph, if you understood the paragraph structure, otherwise go through those episodes. That's why I taught it in the initial stage. That's very, very important. Main idea or the purpose of something will never be in the last sentence. When you write a letter, how do you write? Do you write the purpose of that letter at the end?
No.
Purpose paragraph at the end? No. As simple as that. Purpose should be given clearly in the beginning, wherever it is. Whatever you do, whether a letter, a paragraph, a essay, article, whatever, a book.
A, father.
So it is A.
Some
It is A
some
because
changes.
Changes,
It is
Yeah,
upgrade,
they're announcement. It's an
announcing.
important announcement. On Thursday, 13th September, all the health professionals will be given 1 billion rupees each.
Mhm.
And at the end, they say maybe you can buy a car, buy a house, or go for a travel and resign the job. All these are the benefits of that $1 billion.
Mm.
So, what is the purpose of announcement? What is the announcement?
$1
$1 billion
million.
That
will
is
be given, right?
the
Not what you can do with that 1 billion. So, clearly it is given on Thursday, 13th September, Health Director will be releasing version 3.9 of the video call platform. 3.9 means like 2.0 OET, new version. Okay. This upgrade again means
Announcement.
announcement. No, announcement means this upgrade means
version
change,
3.9
changes.
versions.
Changes. Yeah, upgrade. Upgrade means change. What is the new upgrade? What is the new change? Okay, version 3.9 is new change. OET 2.0 is the new version. This upgrade, this change will not affect the operation of the video call platform, and you will be able to continue to platform telehealth consultation to upgrade. If you remember, I have given another strategy like keywords. Repeated words will be the main thing.
Yes, Father.
Hmm?
Yes.
And everything mobile friendly speaks about change. Simple navigation, fewer clicks speaks about new change. Improved functionality speaks about change. Quicker page response speaks about change. Correct?
Yes, Father.
Yeah. If you have gone through those videos or you have attended paragraph structure sessions, you will definitely, without any difficulty, you will say.
A.
Option.
Answer is
You will never go to say useful features because that is in the last part. Last part never can be means you cannot write a purpose paragraph at the end of your letter, OET letter, right?
yes, Father.
So imagine somebody is asking you, the purpose letter of the OET letter is in the beginning of the letter or the end of the letter. You say at the end of the letter. How does it sound?
No, sounds not
As
good.
simple as that. If you know the strategy, that's why I said you have to go do the guided practice step by step. Attending sessions itself or we watching videos itself will not help you much. Main challenge that you face is you watch all the videos, you attend from all the institutes, all the platforms, and it's a mixed up confusion for you. It will not help you. It will give you a what you call illusion of competency. Oh, I have studied so much. That's not competency. Competency, patient with patience, you have to go step by step in training. It doesn't require long time. Other way about it will take years, but this will require maximum 4 to 6 months. Typically, if you go on. Are you convinced of this? Even in the previous session, I told you most important information will be given in the beginning. Less information will be given in the next line. Then even lesser important or examples or illustrations will be given next. Then will be the conclusion or link. Triangle, you remember triangle I showed you?
Yes, Father. Yes, Father.
Like this. I don't know whether it is here, but I'll show you one triangle.
Most important information is generally.
Yeah, exactly. I have taught it several times. If you remember that, this type of questions very often you have. See, this is not the case.
No.
Let me make some colorful. Yes, this is not the case.
Ulta.
Okay, this is the case. First type of paragraph structure. Okay, you have one sec. You have topic sentence here on top. First, the most important. Okay. On top. First portion of the paragraph. This is the topic sentence, we call it. Means purpose,
Main idea.
message, gist. All these questions will have
Topic sentence.
here.
Topic
Means,
sentence.
yeah, main idea of the paragraph.
Main idea.
Main idea of the paragraph. Then you have after this, what you have after topic sentence? You have
Supporting
sentence.
supporting sentence, which means it explains the main idea. Explains the main idea. Explains main idea or topic sentence. Or topic sentence. PS means topic sentence. That is the second portion. Then what you have?
Developing sentence.
Developing sentence.
Developing sentence. Means what?
Explain or illustrate.
Illustrate means prove. Give some proofs.
Example.
Evidence.
Example.
Proof.
Example.
Example. Evidence.
Enumerate.
Yeah. Enumerate, no? Enumerate means summarize, okay? This will not summarize. Summarize will be at the end. Okay. This is, yeah, developing sentence. Then next one.
Conclusion.
Conclusion or link or enumeration or whatever you want to say. Okay. Conclusion.
Or link.
Or
Link.
Or
Link.
link. Or enumeration or summarizing, whatever. Conclusion is. That is the last portion. Here. So when they ask what is the purpose of this, where should you concentrate?
Topic sentence.
Yeah, on top.
Topic sentence.
On top, yes. So if you have that idea, do you have any confusion here in this question? Will you go here? If you have this idea, you will eliminate, you will eliminate this portion in the beginning itself. Half of it is done when you see it is asking for purpose. And in some cases, maybe you have a different thing. How is it? It will be like, sorry. Second type of paragraph. How will it be? Somebody said enumerate. Enumerate means summarize. Sometimes they summarize, and in the conclusion,
List.
they will repeat the topic sentence. In other words. So conclusion, they will be repeating the same topic sentence. Okay. At conclusion, same thing will be repeated. Same message, paraphrased. So you have at the end again the summary of the topic sentence or paraphrasing of the topic sentence. But here you don't have it. This is the second type of paragraph. First topic sentence, then summary, summarizing, paraphrasing the topic sentence again. Did you get the idea?
Yes, sir.
For example, if you say Mahatma Gandhiji is the father of our nation in the topic sentence, they will explain why you say that, what did he do, all those his sacrifices, his life and death for our country. Then you say at the end of the paragraph, you say, hence or therefore, Indians proudly respect him as the father of the nation. That same thing paraphrased in other words. Introduce with the purpose, then establish the purpose and state it at the end. Any other clarification?
No, clear, Father.
It's clear.
Shall I stop sharing? Yes, if you have anything, you can ask me on any subtest now. There is one instrument, okay, I don't know who it is. If you have distractions at the background, please don't. Right.
Shamin.
Okay.
That means take down those names, no, because such people will repeat the same thing. So that's why people go into 5, 10 attempts because they don't respect their studies, their subject. Okay, we understand your schedules and all that. Admins and me, we are not sitting here because we have no other work. Now you want to learn, then you go for cooking in between sessions, how much you will understand. Totally that it is insulting OET. That's why we keep on saying, I love OET. If you love somebody, if you have a fiancé, when he comes home, will you be cooking and going somewhere and doing some other thing without attending to that person? Maybe you're all innocent, you don't know what's a love affair, so we can't explain it only. Cool. Any other doubts? Anything? You can ask fast, because if you ask me over the WhatsApp and Telegram, I will not be able to explain and give you answers for everyone. That's why I give you some time after the sessions. At YouTube, if you want to come and join and ask here, you can join, no problem. I'll give you the link. And you are supposed to enter, okay? Enter in advance. Okay, you have to register to join the Zoom from the beginning. You have to register in the WhatsApp number given. Okay. Always it is the norm to protect the platform and you from spammers. Okay, I have repeatedly posted there. You can remain in the YouTube. Don't get disconnected, because if you can't enter here for some reasons. And again, the vacancies, you have seen the notice, right? So, yeah, I'm just opening a window. In this link, if you go, today it is announced. There are things announced from 19th, even today, vacancies are announced. One of the biggest recruitment agencies from Ireland. You have more than 6,000 openings. Okay. link is there. I have posted. If you want to see, look into it, you can just see the link is posted in the Zoom chat. You can save it. Just paste that in the Google. They will take you to the site. Oh, I did not share, right? Did you see the site? No.
Yes, Father. In Zoom chat, there is link.
No. The site is this. Did you see this? No.
No.
Earlier I forgot to share it. Okay, this is the site. You can just copy and paste it here. Then you have these details. Even other details are there. You can find all the salary details, vacancies. Not only this, there are many other sites. You can just search for it here. And I have given a brief here in the Telegram. Okay. And this poster you have seen, right? This in pediatrics, emergency ward, cath lab, cardiology, endoscopy, operation theatre, ED department. Strictly on most of the vacancies are in pediatrics and emergency wards. Yeah. Can you see this poster? Hello?
The post is not clear. It's in the
Not clear. Father.
Not clear?
yes.
It is faded.
No, now
Yes,
it's
now it is clear.
That's the internet issue, maybe.
again.
It will come. Maybe internet delay. It's coming. Is it clear?
No, Father.
It's teaching patients. Not yet?
No, Father.
I'll take and give you another one.
Yeah, now it is clear.
Oh, then I stopped. Okay, I'll get it from my download folder. It's gone now, right?
Gone, Father, now.
Yes. I'll get it from my download folder. This must be clearer, I believe. Let me share. Yeah. Now let's check. It will take 2-3 seconds. Can you
Now
see
vacancy
everything?
page is clear. Yes, Father. Visible.
Visible, right? You can save the other link if you want to look into it. Cork Area Hospital, all those your charges will be reimbursed. You have no expenses, everything will be reimbursed. Since many were asking me, messaging me, your expenses for visa processing and DL, aptitude test, everything will be reimbursed by them, by the hospital. And preference is given for people who have experience into at least 200-bedded hospital for the emergency department. 2 years or more. 5 years experience will be counted better. Because many were asking me for saying that we are not finding any opportunities. Maybe if you search, you have a lot of opportunities in different places now opening up. Is that cool?
Yes, Father.
Anybody wants to join from YouTube here, you can come here to ask any clarifications. Do you have any clarifications? Comments. Father, for today's one, thank you. Yes. Anything else you want to ask? Discussions are going on good. Congratulations for those who are participating. It's really the best way to enhance your competency. Teaching once is equivalent to learning 20 times. No. Regarding skills, you will definitely have a cutting edge instead of alone sitting and practicing, getting irritated, frustrated, bored. Especially appreciate admins Mini and Nitya, who are spending a lot of time to assist at the discussions. Only smile is missing in the discussions. Not everything else is perfect. I wanted to start with a smile. The whole discussion I searched one smiling face, at least one sentence I can cut it and put in the beginning. But I didn't find. Yes. Right. Smile is very, very expensive. I don't know why. Did they teach you during your training you shouldn't smile?
Yeah, during class time, actually, they will send outside. That's the problem.
Pardon?
Yeah, during the class time, you will laugh, they will send outside.
Okay. But then
So we learned that we need to quiet sit.
My goodness. No, yesterday I was searching for a smile anywhere. Throughout the video, I was searching for one sentence from anybody so that I will put that sentence. Yes. You should bring one comedian in the beginning to make you smile. That's not. The reality shows they do. They show great comedies in the beginning, and all those claps are copied and pasted during the other comedy sessions. Even if you don't laugh, that will be pasted here. So I learned to find somewhere some smiles and paste from there to here.
Once you told me you come and join the discussion for some days, but now you didn't come now. Father told no. Father surprisingly come and visit the discussion.
Yeah, but then after that I was having sessions, right? Continuously. I have to prepare my PPT, right? I'll come sometimes.
Other than the class days, other than the live session.
Yeah. Other than the class days, I have to prepare my PPTs. So these are actually very, very, like the images were sent to me, like the material, no? It's very difficult to copy and paste. It took a lot of time. Especially the part A, no, it's challenging to copy and paste, and you know how many slides. For each question, I have to prepare one slide. First, I made it together. Then I know you will not understand. You will get confused. So for each question, I created text. Maybe if there are 6 questions, text A, at least almost like there is 15 slides. Yeah. And now age, no, not young like you, to make all these columns and boxes and all that. No, it takes patience and time. Yeah. I'll come sometimes. Yeah. But it's going good. At least a couple of them are enjoying it. That's great. Now, from my experience, I know in this platform, that is the most powerful, even powerful than the sessions, discussions. Even when it was going on the Telegram, that was powerful because people used to think, reflect. Now you see, just you listen and say that I understood. But when you practice, when others discuss, you understand, okay, this is the way. I did not understand that way. Now, when I teach you, so okay, that is the way. You have no doubts, no counters. But when one of you is teaching, is it that true? You will have a doubt. Then you will discuss. Then you will confirm. That is the real learning.
Father,
Hmm.
I have a doubt in our, the question we discussed in the part B, question number 2. It's not
Okay.
the doubt, like, the how we eliminate the C option.
Question number 2.
Till now, my kids disturbing, that's failing now.
Yeah, okay, number 2. Number 2. Where is it? Number 2, yes. Let me check. Number 2. This one, right?
Yes, Father, this one.
Who change their packing arrangements must pay an administration fee. Who change their packing arrangements?
From the last sentence, we can, they're confused with the model verb may and must. It's like,
If an
from that
employee
sentence,
elects to change their packaging arrangements during the packaging year, they may incur an alteration fee, additional.
oh.
You have to pay the fee if you change the packaging arrangements during the packaging year. Within 1 year, if you change, you may have to pay additional fee, alteration fee.
Okay. May means the possibility, right?
Yeah, possibility. You may have to pay.
Okay.
Here, first one is you must pay. Each health agency will charge you. Will charge you means factual. No may. May charge you, no. Will charge you. Means you must pay.
Okay.
Hmm?
So in the option C also saying like must pay.
Yeah,
Maybe
who
like,
change their packaging arrangements must pay. Here it is may incur, may pay. This one.
oh, okay.
This is may
Okay.
pay. Here it is must pay.
That means that's the reason we eliminate the option C, right?
Not only that, the directive informs not this one. This is not the information that see even informs what is the purpose of directive. What is the information given? That's the main thing, no? What does the letter that is given by the hospital, what does it inform you? Means the main information, right? Main information can never be at the end.
Oh, okay.
Okay. This they are saying already you have to pay your administration fee.
Administration fee.
1% of your this one will be deducted from your salary. 1% administration fee. If at all you make a packaging and a change in your packaging arrangements, a penalty fee may appear. You may have to pay an alteration fee, additional fee. For example, you are paying, we are paying 2,000 registration fee, but you made a changed your packaging arrangements. Then with the 2,000, you will have to pay 300 additional fee. But that is not the main information given, right? The main information is that you must pay a fee will be deducted from your salary in normal situations, in all instances. Okay. Here they are saying, see this one, did you understand? Even that you can take as a clue, but I am not confusing you. There are beginners. See, if you change the packaging arrangements, must pay. The option says must pay. Here they are saying may incur. May incur means maybe sometimes. Otherwise, maybe if the management is in good mood with you, they may not charge you. May or may not. But the third option says must pay.
Okay.
Got it?
Okay.
Hmm?
Thank you, Father. Thank you so much. Yeah.
Yeah.
I always confused with them, these model
Yeah.
verbs.
If you are,
Very
you
difficult
want,
to
if you
correlate
may
with
get,
the thing.
you may
But the
have a
model verb
second.
is confusing me. Yeah.
See, when I say you may have a second marriage, it's not you must have a second marriage.
Oh, okay.
You may means വേണമെങ്കിൽ. You can.
Okay.
Other one is കെട്ടിയിരിക്കണം. Right. Must.
Oh, okay. Different. Thank you,
കെട്ടിയില്ലെങ്കിൽ
Father. Thank you
വെടിവെച്ച്
so much.
കെട്ടിയില്ലെങ്കിൽ വെടിവെച്ച് വെട്ടിക്കൊല്ലും. Yes. That's it.
Okay.
Clear?
Okay, it's clear. Thank you, Father. Thank you.
Yes. It will take some time. As you go on practicing, this becomes very evident. Things are very easy. Only thing I have the confusion how to explain to you because you are of different grades. No? Some are experts, some are beginners, some are midway on the way. So it's confusing. If it's a batch, it's very cool. Systematically, we can go because they will know. I know what you know previously, what I have to teach next. Yes. Yes. Anything else? Anybody wanting to ask anything, you can ask now. Yes. Further class carries episode 10. Will it be updated after the class or is it another volume of 10? Oh, this is class session 11, right? This is episode 11. Okay. Did I give in the notice 10? However, 10 or 11, or if you take it as 10 A, B, and B, A and B, it doesn't matter. Only the content matters. That shows I am old man. My brain is not working as effectively as it should be. There is a comment space and there is somebody has commented. Further, the class carries episode 10. Will it be updated after the class or is it another volume of 10? If you want a B volume, you can make it B or you can make it volume 11. We'll check if there is a mistake. Yes, that is cool. No, unique knowledge of workplace. What is that? I didn't understand. Severest, unique knowledge of workplace. I didn't understand, Ma. Is there some clarification? Yes. Explain the answer which was discussing in the main platform. Linivagis, I didn't understand which was being discussed in the main platform. In such cases, what you have to give, you have to send it to me personally. Probably better to be sent it to my Telegram chat and inform me at WhatsApp. So sometimes there are so many discussions going on, I will not be able to go through everything. Whenever you have a confusion, doubt in the main platform, when you discuss or anywhere, you can send me that material with the answer key. And also you can forward those discussions. What was the discussion? What was the problem? What was, so if you send forward a couple of responses, I understand where you have the problem. If you can tell me now, I can explain. Some Linevargis is asking, could you please explain the answer which was discussed in the main platform? Let me check if it is somewhere close by. If you can tell me the time, I can look now and tell you. Do you know the time? What time was the discussion on something?
Father, one question regarding listening I posted in the admin group, Father, which was asked.
Okay, that we'll see. But now what Linivargis is asking, any idea where it is? That is in the admin group. I can even check out and look into it in the next session. This will be fast right after so many postings. Linivargis, are you here? If you know the time, just tell me what time in the main platform.
Is it regarding you're a veterinarian and the owner of a cat discussing how to give insulin to our pet? Is it that? What does the veterinarian say is most important.
Maybe Lini is looking into it.
Is it that?
No, she is looking into it, I believe. She is responding yes. Let's see. One who asked about writing, no, writing is being a step by step, step 1, 2, 3, 4, 5, 6, all the steps are posted daily. Okay, listening also, some are asking me personally, listening links. They are also posted every day by the chief admin. Almost 90% of the previous links are posted every day. No response. Yeah, anyone else has any other? Maybe Lini is searching for it. It's a bit tough to find from the main platform unless we know the timing. No, a lot of chats are there.
Further, she messaged around 10 and yes, same. Maybe Jyoti told that question, maybe that same question.
10 o'clock.
That is an admin group, Father. I posted already.
That is about insulin.
In the main platform, after 8:54 a.m., we have only 1 o'clock. In between, there is no conversation. Maybe some other group, right? Batch group somewhere. Here, there is no conversation between 10 o'clock. Can you see the screen? See 8:54, chief admin has posted something. After that, 1 p.m. Is that right? Can you see my telegram? This one?
Father, around like 1:30.
No, she said 10 o'clock, right? 1:30? What is that?
Yes,
Yeah,
Father,
this one.
That's that
1:30. 1:30. This is 3 o'clock.
Yeah, this one, Father.
So there's no audio, no? This is listening, right? Hello?
He has given the script, Father.
No listening, reading like that, not mentioned, Father.
Where is the script? We can't read that, I believe.
Only question.
You hear a better and sound of the cat discussing how to be instant perfect. This is a scale-based question. Share on the bottom. But this is not opening, right? I will just explain a little the initial steps of admission. A is the answer. Why? See, you hear a veterinarian and the owner of a cat discussing how to give insulin to her pet. What doses the veterinarian say is most important? What does the veterinarian say is most important? Giving more than the recommended dose is more. Giving more than the recommended dose? Oh, that is wrong. Yeah, that's most important. Giving more than the recommended dose, there is a mistake. We should be not giving more than the recommended dose. Keeping the insulin refrigerator is not the most important, they said. Avoiding shaking the bottle is opposite. Keeping the insulin in the refrigerator, they have not mentioned as most important. Even strategically, it should be B. A is, see, here they are saying it is a, so divide the day in half with a line. Recommend drawing a little box in each. That is one more. Could potentially destroy it, so you want to try avoid. Okay, the script is not clear. Answer must be C as per this one. Avoiding shaking the bottle. But what does the veterinary say is most important? That's what he is mentioning here. Giving more than the recommended dose is definitely, even from your general sense, it is wrong, right?
Yes, Father. C, it's the pointing out to C, Father.
Keeping the insulin refrigerated, that is not the, as per the strategy, B could have been the answer, but then this, I don't know how authentic it is. It's really very simple. So the first thing is the insulin needs to be stay refrigerated in the refrigerator. First thing need not be the most important thing. But the most of the stress is about shaking. Don't shake. Okay. The one thing you don't want to do is double dose the insulin. So that is opposite of A.
Yeah.
Opposite of A. So you turn the bottle upside down and roll it gently. Don't shake it. Don't shake it. Very important. And then take out a syringe. What happens if you shake? Yeah, it could potentially destroy it. So you want to try avoid that. Sure. It should be B. Correct?
C, Father. C.
Avoiding shaking the bottle must be the answer.
C is the answer.
C, Father.
I don't know whether it is authentic material. Yes. That's clear because first one is opposite of what is said in the text. Anything else? Yeah, at least try to, when you watch the video, at least try to like it, okay? And pass one comment. Jyoti has mentioned that to ask questions. They will not ask you questions, okay? If there are questions, you can answer. Otherwise, what you have to do is you have to like and send informations. That's your duty. Okay. Click on the like button, even the response what they have given. No, you can, if you need to like, you can like. Okay, if you are shouting at us, don't like. Okay, dislike. Okay, right. And others also can do that. Like whenever you go, just click the like buttons for as many as videos. You know, likes are less than 1% for us. You go to any video, you will find if there are 1 lakh views. If there are 10,000 views, you can see 8 likes, 10 likes out of 10,000 people who watched. Health professionals are so selfish, I didn't know. Then they say, Then they write a big notice to me saying that wonderful, great, wonderful in my WhatsApp or Telegram, by which they know that will not benefit anybody. But if they write that in the comment space or like it, somebody will benefit. So damn sure nobody should benefit because of me. Yes. Today's likes, can you see likes? No, I can't see. How many likes are there today?
26.
26 out of 282 people. Eh? 282 people at different times. At different times, 282 people have visited us, entered the classroom. Yes, 29. Yeah. Concurrent views. Chat rate 11. And encourage people to just chat once the link is given. No? That will help to reach more people before the session begins. You should please send some chats. There are some people who send. Now you see Dorothy with a super chat. She is flooding the chat box. Yes. Yes. Anything else? Manisha, Mr. C, who are these people? No idea. Tapana. These are the best opportunity where you can ask, okay?
What about today?
Today's discussion, Admin Mini and Nitya will decide and let us know. We'll wait for the announcement. Correct?
Shall we conduct at 8:30 if they are willing?
Yeah, definitely. Yeah, you need not ask for it at all. If you are all willing, nobody can block you. Even if I block, Mary Jackson is as the key, so I can lock. Right? So there is no permission required. Full key is with you. Yeah. And if you want to change it to 5 o'clock, no issue, except for the session. So except for the days, except for the days when there is session, it will be difficult. Otherwise, no issue. As you wish.
Okay.
And but Minnie Jackson had to smile. That's all. Minnie, she was asking, shall we anticipate the discussion to 5:30 or something like that?
Yeah, I can. They are here. I cannot able to talk on the audio. They are disturbing me.
Okay. We will register a case against them. Kutus and tutus. Yeah.
If the participants are willing, we are planning to change it to 5 p.m. because 8:30 is somewhat
Yeah, no problem.
inconvenient to us.
Any time between 24 hours, you can choose, no issues.
Okay,
if both of you have no issue, nobody else has an issue.
Today onwards, we are trying to smile, Father.
Okay, let's see. Otherwise, I get exhausted while editing, no? No energy. Editing is a very irritating task. For people like me, it takes a lot of trouble. Other day, Jyoti was sick, so I had to edit all her coughs. Every 100 coughs I edited. Yes. And photos, we want like some energetic photos, not passport size, stagnant. Some photos with a smile and some movement. Other day, Deepika's photo you saw. I made her to hold that discussion day too in her hand. Yes.
Live still is on.
Okay, we will end nobody else there too. Yes. Let them also know about discussion, change of time and all that. Yeah.